Senator Hawley.
Thank you very much, Mr. Chairman. Thanks to the witnesses for being here. Dr. Ramachandran, I'd like to start with you if I can, and I want to come back to this topic about the price of prescription drugs and the availability of prescription drugs. I note that you're both a researcher, professor, and also a clinician, a primary care physician, so you have up close and personal experience with this. Let me just throw out some statistics that caught my eye and get your reaction to them. Between 2010 and 2021, the United States lost 26,000 independent pharmacies. 45 million Americans now live in pharmacy deserts where there is no pharmacy, local pharmacy, or any pharmacy within driving distance. That includes in my home state of Missouri. You know, Missouri, we've got 2 entire counties that have 0 pharmacies of any kind. 0. 2 whole counties. CVS, I note, this year announced plans to close 271 retail stores. Walgreens says over the next 2 years it will close 1,200 stores. So we're seeing mass consolidation. 3 companies, I think, control 80% of U.S. prescription drugs. What's the effect on patients from this mass consolidation and lack of access?
It's devastating. I'll say I have personally seen this with my patients where they're having to either figure out how to drive an hour or 2 hours even farther away to be able to pick up prescription drugs, especially for things that are emergent, like an asthma inhaler in particular. And this has just caused devastating effects and sometimes have landed them in the hospital or even worse. So it's definitely a huge problem, and also, results of, as mentioned, the consolidation, the various stakeholders that are not being regulated, that there's not proper oversight over, including pharmacy benefit managers, as well as the pharmaceutical companies that enable incentives for those entities as well. We have a huge problem with our pharmaceutical supply chain in terms of who's controlling access, price, and availability of these medications.
Let me just ask you about that point because I think it's so important. Let's just stick on PBMs for a second. Is it a good idea, do you think, to allow PBMs to buy up independent pharmacies and other pieces of the medical supply chain? I mean, should PBMs be purchasing pharmacies and purchasing doctors' practices in some cases and purchasing hospitals or merging with hospitals? Is that kind of consolidation across vertical consolidation across the medical supply chain, is that a good thing for patients?
No, and we know this from various studies, including studies that we've conducted looking at patient outcomes. When that has occurred, outcomes on patients are worse. If outcomes for patients were actually better in terms of access, quality of care, and things like that, we would be having a different conversation. But instead, we're seeing the opposite. And in particular, it's because they're prioritizing kind of bottom lines. What can they do to be able to maximize profit instead of actually thinking about patient outcomes? Let
me read to you from a recent news article about private equity and their entry into the healthcare system. Here's a quote: "When private equity enters healthcare, closures are not side effects, they're the business model. Extracting value for investors comes at the cost of extracting access from patients." It seems like to me one of the big problems we have in our health system today in the United States is we've got a lot of companies and corporations who are rapidly consolidating, and they're strip mining the American health system for their profits, but not for the good of patients. So prescription drug prices keep going up, up, up. Access to those drugs continues to decline. So what are some prescriptions you would give us as policymakers to address these problems?
I know the committee, and especially you as Senator, have been talking about reforms to various parts of the supply chain, including obviously pharmaceutical companies, but also PBMs, right, to actually address this issue around consolidation. Obviously, regulation of private equity, right, because to having oversight of these deals, which has been happening in some states to some extent, but usually after there is some harm that's occurring to patients. Being able to be proactive, to be able to stop the sort of consolidation, these merger and acquisitions, and be able to understand what the impacts are on patients before they happen, I think is most important, and that's going to require regulation. And also entities like the Federal Trade Commission to step in to actually ensure that anti-competitive practices are not moving forward.
I've always been a big believer in antitrust as an attorney, as a believer in a free market. I mean, a free market works best when there's competition, when there's free and open competition. That's what keeps prices down. That's what benefits consumers. And when you see the kind of consolidation we are seeing, whether it's on the pharmacy side, whether it's on the big pharma, the production of pharmaceutical side, I think it's really no surprise that we're seeing the increase in prices, but the decrease in care to consumers. And so you're right. This is why I believe one of the things we ought to do immediately is prevent PBMs from buying up every aspect of the supply chain. Why should PBMs be able to own all these pharmacies? Why should they be able to start buying doctors' practices? We don't allow that in other aspects of our economy. Why should we be allowing it in healthcare? I think it's nuts. And I think it's time we actually, in our competition policy, started putting patients first. So thank you for the work you've done on this. Thanks for the rest of the panel, and thank you, Mr. Chairman.